All right, welcome back, welcome back. Good night, good night, good night, good night, world. Good night, Jamaica, and good night, Portmore. This is another JASL After Dark. Welcome to another episode of JASL After Dark. We are here every Wednesday at 8 p.m. Reminding everyone that you can stream the show in multiple places. You can listen here on Sun City 104.9 FM, on Instagram at JASL Info, and on Facebook at Jamaica Aid Support for Life. So, of course, we're going to take an interesting topic of discussion tonight. So you definitely want to keep locked in, tuned in to tonight's episode.
Mm-hmm. Yes, so we offer HIV treatment and we also offer free HIV and syphilis testing, free condoms and lubes.
Free.
Free.
No cost.
No cost. No
All
cost.
free.
Free theater, free com. All right, and of course, I am Ryan Devonaire Dixon, one of the hosts. But listen, we're not going to be here by ourselves. We're going to be talking with our guests of the week, who are Dr. Alex Tracy and sexologist Shelly Ann Weeks. All right, Calvin, what's happening for this week? What's our topic for tonight?
So this week we are looking at the ups and downs of erectile dysfunction.
So again, I want you to repeat that topic.
Yes, so this week on JASL After Dark, we are looking at the ups and downs of erectile dysfunction.
Erectile dysfunction.
Listen though,
I'm
Calvin,
here for it. I'm ready.
you sure that's the topic?
I'm ready for it.
The irony of it is of it all is that there is no up. When it comes on erectile dysfunction,
There is.
Yeah,
Because
there
it's
is.
up and down. It goes up and down.
Perhaps the up is not as much as the down.
Exactly. So it really goes up and down.
I think dysfunctional and I don't think you're getting up.
But it's not for long though when it goes up.
Oh, yeah.
You understand?
You gotta take a deep breath.
That's the up and down. That's exactly what it is.
All right. So, well, you know, my favorite part of the show is the hot pot. So many things have happened over last week. So, listen, make we dip into the pot and see what a bubble.
Oh wow. Oh wow. This is really hard part. Okay, so here it goes. Spice and tape measure.
Oh, yeah.
Okay.
Let's talk about that. Oh,
Tape
geez,
measure. What's the irony
I left my
though?
tape measure.
The irony.
I
The
should have walked with my
irony.
tape measure, right?
Erectile dysfunction and talking about the tape measure. Oh wow. Okay, so Spice sent social media into a wild frenzy when she released a teaser for her new single, Tape Measure. The uncut clip featured a male model's genitalia on display. In other words, Spice did have a bunch of men fully nude in her video. What do you guys think about the clip? Were you surprised about this clip? What do you guys think? Tell me. I wasn't surprised. I mean, it's Spice. It's expected.
Mhm.
For some reason, it's expected. But my God,
That was like raw.
soft porn.
No, that wasn't soft.
Full on.
That wasn't
Oh,
soft.
yeah, I gotta think. That was not porn.
That's
Indecent
exposure
and
double. That's raw.
X.
All right, so here's my take on it. there was two sides to it. Because for me, I wasn't
It
not
is.
frenzy over it, of course, but I'm proud of Spice. Why? Spice pushes the boundaries. She pushes the envelope, and it really is embodying her whole demeanor and Monica as Spice.
As Spice.
Everything about her is just spicy. That music video was not short of spice. And I'm loving the fact also that the men she chose represented us well.
Oh wow. I guess it was too much spice. As I said, there's two sides to it. I did expect that from Spice. I just think it was a little bit too much. It
Was
wasn't
that in the
too
final
much.
cut though?
No,
The teaser?
It wasn't in the final
Wasn't,
cut.
no.
So I mean, it's okay as a teaser as long as it's not in the final cut. You know, I'm all here for it at the end of the day. But as long as it's in the final cut, I'm good. You know, but it's okay.
We
It's
have to
nice.
remember that kids are going to be curious of what we are talking about, and we see that on Twitter. We remember they're on social media. They're going to access it on YouTube. So Shadi has a point of as long as it's not in the final cut. But for the teaser,
I mean, it's good. If I measure things, I know where you take and how it goes.
Yeah.
What's wrong with that?
I mean, for years-
I have to know.
For years, we've spoken about, Calvin, we've spoken about, you know, the birds and the bees and all and something there. And we've had many other references to what a man's length or, you know, capacity is.
Right.
Because they talk about the size shoes they wear. Some will put up my shoes.
Exactly. So,
what you showing up?
The size 11 and a half.
Well, I wear 12. I wear 12 and 13.
oh
You know.
wow. Oh wow. Oh wow. Is that true, guys? Is that true?
Absolutely true.
It's absolutely true.
Absolutely
Okay. I mean, it's an ego.
But for me, my take on the whole Spice situation, as you guys have said, it's on brand for Spice. You expect something that's outside of the box. I think she has done well in the past in terms of teasing her new songs, teasing her new videos. So this was nothing short. If this was the full video now, that's where I would have had the issue. But for a teaser, I don't think
It's good for marketing.
It's good for
And she's
marketing.
really
Yeah.
good at marketing.
Yeah.
Spice is good at marketing. I love
The
her
boss.
for that.
The
Yeah,
boss.
man.
Remember
Yeah.
the black hypocrisy one?
Mm-hmm.
Social media went in a frenzy. So it's just Spice being good at her marketing, being outside the box. It's all on brand. So no harm done.
No.
What do you guys think of the song overall though? Like,
I haven't listened to the full length.
Oh wow. Listen.
Yeah, you go to
It's
the
when
other
you say
words.
the tape measure pull out. And I see all of that happening.
you should have into the song. She just do the full length.
I haven't either.
Oh, you haven't?
No.
You haven't taken it the full length.
No, I haven't.
Off the song.
I mean, the teaser alone have me. I'm like, okay,
Oh.
this is it. We can work with
I
it.
listened to the full song.
Who is it?
Honestly, the teaser, I felt like something bigger, no pun intended, was coming.
Oh, wow.
But
You get tricked. You
but-
get tricked. That's what you're saying.
yeah, I feel like I get tricked. I feel like the song
Yeah.
wasn't that hot.
Oh, I haven't listened to it, so I can't comment on it.
Mhm.
Yeah, so.
I think she should release a video of the whole teaser.
I think she said when she gets to 1 million views, she'll release the full thing on
Yeah, yeah. Have it as a different, you know, like an extra, like a bonus track
Yeah,
or something.
bonus.
But yeah, she did go in hard on that. Well, here's the thing though.
Going hard.
would-
You know
would-
what it's using?
would
Length
we-
and hard.
Yeah.
Oh my.
What kind of, would we have the same approach to her using males being fully on display if it was a male artist using females in the same manner?
Yeah, no, a lot of persons would have
Double
commented
standard.
on that on social media and said, oh, look at all the years man them use naked girl in them video and nobody know have no problem. No Spice use a one man and everybody in front of. So there's that aspect to
I
it.
don't see anybody art. I don't hear or see any tweet about there's no complaint. I don't get no complaint.
I mean, the only thing I saw was the Dexter video, bring it to the corner. That was pretty raw.
Mm-hmm.
In the pool when they were really naked, going on and on. So probably that's the
Yeah,
closest
there,
thing.
there are a few videos
Yes,
out there.
there are.
Because
Yeah.
he did another one. The last time I think he recording, he did a video of with there was some young ladies with some bubble bath. It was some bumps about something. I think I don't. Nobody saw the video.
Okay, so Muriel on our WhatsApp line is saying that Crazy Bean played the length yesterday.
Oh yes, it was featured.
Big up Spice.
So well, Spice, is that?
I'll have to go listen to it. I'll definitely write that down to go listen to it.
Yeah, it's all right. That's one way to tell.
All right, so you just heard our views about tape measure, but my question for those listening to us on the radio and watching online, ladies, does size matter? And men, are you comfortable with your tool?
With your size?
Are you comfortable? Yes, this is JASL After Dark, brought to you by Jamaica AIDS Support for Life, reminding you that we provide free HIV and syphilis tests and free condoms and lubes, along with free HIV treatment. So remember to follow our social media pages or call us at 876-925-0021.
And this question has come to mind. And what about PrEP? You
Yes, so
distribute PrEP or
yes.
you sell it or so?
All right, so PrEP. So for those who don't know, Lavados inserted something new for us. So PrEP is pre-exposure prophylaxis, which is a one-a-day pill that helps to reduce your chances of contracting HIV. We offer PrEP to persons at substantial likelihood of contracting HIV, those most at risk. To find out if PrEP is right for you, you can also DM us or call us 876-925-0021.
All right, so
Nice.
have you covered and protected in more ways than one? All right.
Be prepared.
Anybody texting about them?
Muriel is
Exactly.
So you got a number to call?
Yes, so you can WhatsApp or call us at 876-392-6217.
And Muriel is saying no, size doesn't matter. It's who they
How them use it?
Or how I guess.
Yeah,
Yeah.
she corrected it. She said, oh, they
Oh,
use
they
it.
use it.
Okay, what are they saying on the Instagram here?
Hi, Cadet.
Let's see.
Well, we were going on. Blessings. It's good to have you join us at night. Yeah?
Alright. So you probably want to repeat the question for those men who
Sure.
just joined
So
us.
let me just ask them. Ladies, does size matter? And men, are you comfortable with your tool? My very nice co-host.
We need to answer.
Yeah, I
Oh.
I just need to know. Like, are you comfortable with your tool? We need to know.
Quick story. I growing up when I was much younger. I
No
used to think
story,
I
yes,
was.
no.
Are you
Yes,
comfortable with your tool?
Yes or
I
no?
just want to know.
Yes or no?
Very comfortable.
Very comfortable. How about you, Calvin?
Yes, I'm very comfortable.
You're very comfortable. So for me, does size really matter? No, it doesn't matter. It's just how you use it. And once you have that connection with the person, that sexual connection, that sexual chemistry, that sexual compatibility, it no matter what size,
It will work.
you will enjoy it. It will work.
That you want.
Yeah, man. It will work. So you probably get a 7 and feel like a 9. Just them use it. You don't think? You wouldn't know because you're comfortable with your size. Anyways, let's hear them.
Yeah.
Alright, so.
I don't want to give a too conceited answer. I mean, I don't have
But
that
he
problem.
said yes. He's comfortable. Alright, so we are going to move on to.
So it's time for Weird Sex Wednesday.
Oh, wow.
Take us away, Ryan.
It is time for Weird Sex Wednesday. Where am I?
I'm right here. So, sex can be fun and liberating, but sometimes it can be messy, uncomfortable, and different. But regardless, we should never be too shy to talk about it. I always talk about this. Communicate. Sexual communication is key. So, with that said, it's time for Weird Sex Wednesday.
No, you can't tell you that. You sure you want to hear that? You might drop it.
I love watching myself in the mirror. If you can't see my performance, it now go work. Murder! I yes, I. One yes, sir.
It's Weird Sex Wednesday with Sade.
Alright, so let's go. Weird Sex Wednesdays. So this is it. Today. So after being with this guy for over 3 years, we always talk about spicing up our relationship. So what we normally do is watch porn and then send each other and ask if we would want to try. One day he sent me a video with 2 girls and a guy and said he would want us to try that. I just ignored the message. When he come home the day he asked why I never answer and that him always just wanted to do it and him rather do that than cheat. It right my mind over a week, plus I always did want to try a threesome, but I always envision myself in 2 guys. Couple days after, I write him a long message, say, yeah, we can do it. Say, must find a girl, and it can happen at our house. Long story short, we rented an Airbnb, and we get a girl. I'm not telling a lie, I really enjoyed it. What was even weird is that I enjoyed watching him and the next girl even more. And for a good 20 minutes, I just lay down and watch them. After we're done and the girl leave, it's like something wake up in me. I just felt for him even more. This happened about 3 months ago. I will want to experience again, but I'm afraid to bring it up. But I want, okay, what they're saying. I want to know if, okay, she want to know if I share alone after a threesome, you feel for your partner even more. Okay. Did y'all see which part was that? Because if I'm going to ask you which part you think that story they come from. So what do you guys think about this weird sexual experience?
I think it's becoming the norm. Or not the norm, but it is now a more frequent occurrence in relationships.
Okay.
But she wants to know if you get the feeling.
It's almost like when men say that when they step out there and they and you know they go back home to their partner, it's like they fall in love or they just desire their partner more. You know, so I'm wondering if it's something like that maybe.
It depends, I think you see when it comes down to intimacy, as you had said earlier, it comes down to the connection you have with an individual. Right? Truth be told, there's a common saying, you don't know where you have until you lose it. You understand me? And it is the same in the reverse. You don't know what you never have until you get it. Meaning, I could have been with you all this time, compatible, I mean, all right, but then we try something different, and something there's just get up in my skin. So it's either that what I compared you to know makes me want you more, or what I experienced outside of you make me realize I want something else. So it kind of depends on the experience you get, because not everybody perhaps who would have tried a threesome now goes off wanting their partner more. They may want the other person more, as you just said, as well as the relationship could have also offered the person a new experience, desire that. Now, I have heard of situations, actually somebody I know introduced a third party into the relationship. So she was the third guy and they were together. Good relationship. And they decided to invite somebody else. And the guy ended up getting married to somebody else that was introduced to the relationship. To make a long story short. So he ended up liking what he experienced more than what he already had. And probably wouldn't know say that it better for him, or he enjoyed it more.
Right.
Yes, the grass was greener.
But you know what I loved about this? The communication. Because he introduced it with porn.
Yeah.
And I always say when it comes down to your relationship and sexual communicating, find different ways of introducing stuff to your partner. You know, whether it's sex toys or, some threesome or some fantasy or some fetish, whatever you desire, try to find some way to communicate it. And that's how he did his communication, And funny enough, she has never done it before, but then again, how he communicated the thought of it, she decided to do it, which I love that about this situation. But it's still not one of the things the person you come from.
Let me say that,
That's wrong. What you have to say?
I go with Clarendon.
Clarendon?
Yeah.
St. Catherine. St. Catherine.
Wow. That's kind of book more here, right?
Exactly.
I'm going to vote more.
Oh, wow, man.
Look now, it does a it just
It just says St. Catherine. It just says St. Catherine. I think it's Portmore though. Yeah, they just probably never want to say.
Yeah, but
so, what she wants now? Is it she wants another experience with the same
She wants
person?
another experience, but she's afraid to bring it up.
Is it with the same
That's
person?
what I don't understand.
because she might think say
She opening up a can of worms to
She's
me.
opening up something, right?
alright. Who in here watch Peabody? Nobody?
No.
Nobody? Oh my. Okay, there's this character, her name is Mercedes, who is an exotic dancer. And she had this gentleman, he's married, and he's rich because he's a coach for a top team. Anyway, she have this show act called the Mercedes Experience, and he introduced a little contract until and the wife, and the wife experienced Mercedes experience. And yes,
okay.
and then one day behind their back,
I got you.
Mercedes and the wife get together because she was like, I've never felt like this before. And Coach Vex, husband Vex, and get mad when you see there, two of them are so into it, and him not.
Well, when they went back behind his back, he said.
No, they what's that again? No, they were together. Three of them were together, and the wife, because the wife and they went behind them back before, and then when the three of them was getting together now again,
he realized something
he
different.
realized the wife,
them far more familiar with each other
who
now.
was their wife is and he begs and stop and cuss her.
Oh wow.
Yeah.
Oh, wow.
So I do. So maybe that is why she's afraid to bring it up, because maybe he would like,
But
no man, you like this too much,
Mhm.
and it might take away from both of them. So
I mean, at the starting, the communication was good for it to get there in the first place. So I think if they keep on that good communication,
That's
then
exactly what it's about, isn't it?
yeah, it will
But
work.
you know what? The twist can be to it. She can probably want to bring it up because she wants two guys. So that's the twist to it. Yeah, so she got the experience and said, okay, I want to know what it would feel like now to get DP. DP is double penetration. So you may never know.
You're not gonna find that.
You may maybe that's the reason why she's afraid to bring it up.
Oh, because maybe she want the reverse.
Yes.
Okay.
Well, let's just say whichever one it is though, right? What I would recommend is to do what worked in the first place. There was an honest and open communication about wanting to introduce something new to the relationship. It offered a conversation for you to choose whether or not you want to or don't want to. And because he afforded you that opportunity, I think it's only fair that you now having your own personal desire to do something new or something different or to do it again, to communicate with your partner that, listen, that was something that you introduced me to, and I kind of liked it. I wouldn't mind trying it at least one more time. Yeah, because that now can preserve the relationship and what you have going on for you. So that's my 2 cents on that matter. My 3 cents.
No, I definitely concur with you on that.
Yeah. All about the communication.
All about the communication.
All the way.
Yeah. So, all right, I'll listen and take heed.
Alright, so for those listening and watching on IG and Facebook, have you ever had any weird sexual experience? We definitely want to hear about it. So go over to my IG page, that's Fetty Secrets Day Spa or Fetty Secrets _LLC. Send us a message. We want to read those stories. We want to hear about it. This is JASL After Dark. Let's move forward.
Alright, folks, we're gonna take a break. So keep it locked because I don't know after dark it's hot. And it's on the hottest station, right? Alright. Alright, the time is now 8:30.
It's back to school at Bashco has it all for you. Get all your school supplies at any of our Bashco locations island-wide. We have pencils, Bashco, crayons. This Bashco has all of the school supplies.
Right, so for those still on Instagram, remember to share with us your thoughts. Let us know. Does size matter? Does it matter for you, gentlemen? Are you satisfied with your 2? Let us know. Let's see what's going on in the comments.
The size really matter.
August _876 said,
What?
I want to tell a story, but I'm scared.
What can you do if you're not satisfied with what you have?
I mean, try to get some assistance or something. You can help your partner.
Yeah.
There's so many things that you can do.
I mean, so you want to grow your something? Is there many options?
There are options. There are many options.
I don't know.
It can
So
be. I mean, it's a lifestyle. So you have some shops that you can get.
Just
A few people in the comments saying they get to have story, but then them scared to share.
No,
No, we want to hear it. It's not like, I mean, it's fully anonymous.
Right? Share your story. Remember to send a DM to Fetty Secrets Day Spa, Fetty Secrets _LLC.
We won't read your
no.
we won't read your handle.
Yeah, we won't say your name, we won't say your handle. We'll just share your story.
All right,
Somebody wants to go, there's the 13 inches.
But that's a go.
I mean,
the heart.
no,
Listen, after Spice released the video, I saw a lot of comments on Twitter. One person was saying, that, you know, them fine with 6. Like, give me 6. We don't need nothing more. The big ones can stay. So, I don't know why this person want 30.
For those listening, I never said this in our program, but I learned something today that from tip of your thumb to the index finger is typically your length.
That sounds fun.
No.
Me don't know. I just saw me on Instagram. Like, for example,
It does a trick for making it
from here to here is the length of your foot. This is the length of my foot, from here to here.
You measured it?
This is the length of your feet, your foot, from here to here.
No.
Yeah, bet you will lose.
You put your shoes later.
No, you can do it right now. I bet you will lose.
Probably.
I bet you will lose. So, I hear.
Well, I mean, anything possible. Remember they say about women,
They shot.
say,
With
lips match, with lips down here.
One new to me.
So you can
The
judge
one
it.
new to me.
No, they always say, like, the lips, these lips, the nipples, and here, they'll have the same color, but this and this will look alike. They look alike. Very
Interesting.
similar. So you can tell what her lips look like.
So I know that can I kiss you?
Somebody say if you have a problem with my side, take it up with God. Because I know me, I got enjoy myself.
Yeah, but you're enjoying yourself. Is the person enjoying themselves?
It's
Like,
not the thing.
are they having an orgasm?
Whoever is saying this is selfish and they're only thinking
Most
about
time
their
victims
personal.
don't carry orgasm. It doesn't carry pleasure, just a lot of pain. So that's the thing. I don't like that. I don't like man who come with big one and just want to sink it in a people's belly. You know, women can have cervical cancer, low womb, a lot of medical problems can happen for 13 and over.
Men gonna listen and learn, you know.
Big one is not the way to go.
It's not the only way.
And even if you're gifted, you have to know to use it to please the woman.
You have to. I just know which door you have to open.
And it's not always about being a staff on the same boat. You don't always have to come first.
Yeah.
Be a Lazarus.
Yes,
Come
yes.
forth. Make sure come 3 times before you start.
I'm done with
I'm
it.
saying I'm calling from Sensitive Radio.
I'm experienced
GPP. Care what you
I
do.
say if my thing too little,
I put it
I use my hand.
GPP.
Did y'all see this comment on the Instagram though? They said if my thing too little, I'll use my hand or my foot.
Oh gosh.
We don't think that's realistic.
Right?
Is it? Is it?
Alright, we're ready, guys. We're gonna go back.
The questions are for both.
Art. We're
Yeah.
gonna go back.
All right, welcome back. We are back with the JASL After Dark, brought to you by Jamaica Aid Support for Life. Tonight, we are discussing the ups and downs of erectile dysfunction. And tonight, we're going to be joined by 2 experts, Dr. Alex Tracy and sexologist, activist, and author, Shelly Ann Weeks. Good night, Dr. Tracy, and good night, Shelly Ann.
Good night.
Yeah, it should be Dr.
Nice.
Andrews. Dr. Tracy, unfortunately, won't be able to make us.
Okay, so say it again, Calvin.
I'm saying, unfortunately, Dr. Tracy won't be able to make it. So
Oh, is
we
that-
sent it Dr. Andrews in the interim.
Oh, okay, good.
So we still have a doctor to give us that sound medical advice.
Also, so introduce Dr. Andrews again for me then.
So that's Dr. Andrews.
All right.
Yes.
Thank you.
Good night,
Thank you,
Doc.
Dr.
Good night.
So good night, Doc, and Ms. Weeks, how are you? I'm good, you know. I'm good.
We're awesome.
It's good to have you with us tonight.
We are.
Yeah.
We are.
Yes, we're standing for
My full attention is right here. So let me start with you, Dr. Andrews. For us, the laymen, what is erectile dysfunction?
Alright, so good night everyone again. Basically, erectile dysfunction is what we call impotence. It's the inability to achieve or maintain an erection that's sufficient for sexual intercourse, basically.
Okay. And is it normal to have an ED?
In no circumstance is it normal to not be able to have an erection or to maintain an erection. So whenever this happens, people always run and come in to find out what is happening to me.
So basically, Doc, you're telling me that if it ever happens to me, I should be worried right away because there's a problem?
What you find is that almost all cases of erectile dysfunction are treatable once you get down to the root cause.
Okay, so if I experience this, how do I know that I'm just not attracted to this person instead of really having a problem?
So let me just delve into some of the causes first before we just label not being attracted as the main reason. Erectile dysfunction is multifactorial. And most times people think maybe I need that feel to see what's happening with me. But you always have to ask yourself, one, could it be an issue with mental health? Or could it be as a result of my chronic disease? Am I under stress? Or do I have another factor affecting how I perform in bed? All right, like you said a while ago, how do I know I'm not attracted to my partner? The only way you know something like this is you sit and you communicate with your partner. A lot of erectile dysfunction comes with not being able to communicate properly with your partner to understand what's happening between you two and your ability to perform. Have you ever felt pressure in the bedroom and as if, what if I can't satisfy or please my partner, whether it be male or female? Sometimes even performance anxiety can cause erectile dysfunction. Like you have that urge all of a sudden to have intercourse with somebody, but because you feel pressure, you cannot perform again.
All right, let me just interject a question here, Doc. So to help us men understand what's happening, is erectile dysfunction going flaccid, that's the term, after having an orgasm, whether it be premature or otherwise, or is it just an inability to stay erected?
You see, the thing is, don't get confused. It is normal after you have an orgasm or the erection to go away because physiologically you have a lot of blood flow in that area, and after you would have orgasms, then blood moves from that area to other organs. But not being able to achieve an erection is something totally different. All right, let me give you an example for instance. I have a 59-year-old male coming into my office. Doc, I find that as of recent, I'm unable to have intercourse for more than 3 or 5 minutes because I lose the erection. I have the urge to do, but I don't have the urge down there. So you now have to evaluate what could be some of the things causing this. All right? So in elderly population, people who have high pressure, high sugar, high cholesterol, that's uncontrolled. Once you start to get these things under control, then you find an improvement in their ability to maintain an erection. Remember, erection is all about blood flow, blood flow. The penis is a muscle, right? Essentially, and you have a lot of blood flowing to that organ and maintain an erection. And if you have any abnormality that interrupts blood flow there, then that can result in you not being able to feel an erection. Sometimes it's normal for you to wake up with an erection. These persons who have these chronic conditions will find that, hey, Doc, I'm no longer waking up with an erection. What is happening to me? These are some of the signs that your chronic disease is getting uncontrolled and bad. Or you might have a condition that you don't even know about. Now, another example on the spectrum is a young male, 25 years old, had a wonderful sex life in the past, all right? But he finds now that he's not able to maintain an erection, even get an erection. But what he doesn't realize is that 2 or 3 months ago, that horrible breakup, that he had a discussion with his girlfriend that says, I don't like how he's performing, you're weak in bed, you're poor in bed. And that is subconsciously, or you're small, that subconsciously at the back of his mind that is playing a major role in being unable to maintain an erection. Whenever any patient comes into the hospital or a clinic, the first thing you need to do is have an outright discussion to help diagnose the cause of your erectile dysfunction before you administer any pills. Most times, a simple conversation can help somebody to maintain and keep an erection and have a good sex life.
Okay. All right, Dr. Weeks?
I know that I love
Hi, Dr. Weeks. Are you still with us? Okay, that's fine. So my question for you, Dr. Weeks, is so I have my partner and they're going through erectile dysfunction issues. How do I comfort my partner? Or how do we comfort our partners who are going through erectile dysfunction?
I'm not a doctor. So you can call me Shelley-Ann.
Okay, Shelley-Ann, okay.
The next thing is, I didn't hear the doctor saying what he said, but I think it would be irresponsible for us to have this conversation without putting it out there. Erectile dysfunction is sometimes the first symptom to show that you have a heart issue. If you know that might be something you need to check on, go and check your doctor. Erectile dysfunction is sometimes the first symptom because the blood vessels in the penis is so small. It's the first one to get disrupted by your circulatory issues. So you should have that checked out to make sure that something more serious is going on. Moving on to answer your question. How do I comfort my partner who has erectile dysfunction?
Yes.
Well, first of all, laughing is not a good idea. And being criticizing in the moment is not a good idea either. I think a lot of the time a conversation needs to be had. I noticed a trend in the last, I'd say, decade with a lot of young men taking sexual enhancements because they're trying to have a 4-hour or longer erection. And sometimes have side effects. And sometimes the side effects affect their ability to maintain an erection without having to use the enhancement. And what you find is that whenever they find themselves trying to have erection, a solid erection, it becomes very challenging because now they've been so dependent on these pills or potions or whatever it is that they're using to get an erection to begin with. So I think knowing some of that background will help to decide how you respond to your partner. But for this, I would say communication is very, very important because your partner who has this challenge in this direction has to be open to some possible visit to the doctor, possible conversation about what's going on mentally, because as was said before, it could be a stress issue, it could be a question of performance, maybe they have doubts about their ability to perform, maybe he talks a big game and recognizes that he can, it checks, his multiple some checks that his body can deliver on. So it's important to be honest with each other and to be open to have serious conversations and to explore options to solve it because this is solvable.
Right. Okay. So I just need to have open conversations, be as transparent, as candid, and honest with our partners as possible. My next question for you, Shelley. Does weight, being unhealthy, smoking, alcohol, stress, and all of that contributes to erectile dysfunction?
Of course. Of course. And it also contributes to overall unhealthy practices and your unhealthy ability to just perform. A lot of the time, people call erectile dysfunction, they use that term to describe the inability they would like to laugh. But I think that is not part of the conversation that needs to be had. As I said before about some men trying to have a 4-hour erection, for what? I don't know any woman who wants to eat salad for her body jumping up and down for 4 hours. You know how long 4 hours is?
Me, Shelly, and me.
Marathon.
Marathon, I believe in a Shelly marathon.
God go with you because I am not coming. I have things to do in the morning. I don't want any difficulty walking up the stairs in my high heel shoes. So I'm not signing up for that marathon thing. I have to go to work. But for you now, you can find a nice young virile gentleman who can last the 4 hours without having to rub on anything on himself. Might have a challenge meeting that 4 hours in a
My question for you, Dr. Andrews. Are there any common medications that are linked to causing erectile dysfunction?
Yeah, number one, antidepressants. That's why people don't like taking them. Number one thing is that can't take this medication right now. Anxiety bad, but I don't want to mash up my sex life.
One or the other.
It's like, doc, that's like drinking water that makes you thirsty. That's like drinking water that makes you thirsty.
Alcohol is a drug. So alcohol is another drug that can lead to erectile dysfunction. And believe it or not, it's not really something that is common, but I've had a lot of complaints from some persons in the elderly population, like my 60 and 70-year-old doc, this blood pressure medication mashing up my sex life, and I don't like it. I've had to change a lot of medications for my elderly population because some of the antihypertensives can cause it. But you have to reassure some of these people that if it does happen, have a conversation with the doctor, because what they end up doing is stop taking medication altogether to maintain an erection and end up having a stroke or a heart attack from their high blood pressure. Yeah.
Nice.
You see, in Jamaica, there's not much communication, you know. If something doesn't work out that fine, they don't go back to that doctor. They don't talk to the doctor. But even in the office, when you give the patient the medication, you always have to tell them, hey, this is a possible side effect. If it shows up, let me know so we can know what to do about it. We leave a lot unanswered and unsaid, thinking that patients will know what to do, and that is not a good practice. And simply just spending 3 or 5 extra minutes with your patient can save their life and their sex life. And I think that is one of the major things people always value whenever coming to any medication, especially men, that will it destroy my sex life. It's one of the first questions everybody asks when you're going to start a new medication. I just start medication to fix an erectile dysfunction problem, but if we've gone through every single avenue, such as mental health and performance and anxiety, and we start documentation and all this between your partner, and we have another possible cause, like your uncontrolled chronic disease, and we control that, then is when I will decide, after hard testing, I can safely prescribe a drug to help you enhance that performance. But I always tell people, go to your urologist. And sugar is one of the #1 causes of mashing up people's sex life. And if they don't control their diabetes, then it can be a real awkward time in the bedroom. And I really don't wish that on anybody.
Well, no, Dr. Andrews, let me jump in here. Quick question. One question to you and another question to Ms. Weeks. Question to you, Doc, is one, is ED permanent? And if so, or if not, how is it treated? And to you, Ms. Weeks, do you know of ED being hereditary?
Huh? You can go first this week. All right. No, I don't know if it be hereditary. What I would say is the best way to prevent ED is to lead a healthy lifestyle. You cannot lose. First of all, healthy lifestyle improves your circulation,
Remember, as the doctor says, your penis is a muscle. A stronger muscle gives you a stronger erection. If you are healthy, you're able to get that stamina that you need. You're able to laugh. You're able to go on marathons. Like my colleague in the studio, because she wants a marathon man. So a healthy lifestyle. Ensure you exercise and watch your health overall. So you won't have to be on all of these other medications. It's a great way to ensure that you prevent erectile dysfunction. And even if you have to deal with it, having a healthier lifestyle definitely improves your chances of success.
All right. And Doc, your question?
Asking me if you're asking me
If ED is yeah, and if it's not, then how is it treated? How can one treat it?
all right, let's put it this way. ED can be permanent depending on the cause. If there is nerve damage, then I'm sorry for that erection. You may have nerve damage, especially conditions like diabetes, and unfortunately in spinal cord injury, like especially I have some young patients, 22 years old, motorbike accident, severed spinal cord or loss of spinal cord damage, can't maintain an erection anymore for their life. There's nothing I can do in terms of medication per se, but there are other therapies overseas where you can have mechanical assistance with that. But in terms of nerve, where you have a long-standing damage to your nerves over a course of many years from diabetes, then that ED can be permanent, and you would require some assistance. I won't say over the air the type of medication that you should use because it should be prescribed by a doctor, and you should go to a doctor to get it. I don't want anybody to get any ideas and run going and buy these things, So I always advise person, be totally permanent, but what you can do to prevent it, simple things, waking up in the morning, running, exercising, it's one of the biggest things. It changes a lot of person's life. 2, put down the cigarette. Now, a lot of doctors like to say, hey, quit smoking. But have you ever tried to break a bad habit? It's almost impossible. The only way you can stop smoking is first to reduce it. Let's say you could smoke 10 cigarettes a day, you reduce it to 6 or 5. And then over the course of 30 days, a habit is formed. So it'll take you at least 30 days to break a habit. And once you get rid of a bad habit, you have to replace it with a good habit. So every time you feel the smoke, you replace it with, oh, let me go talk to my child. Let me go do this. Let me go do that. Something positive, because whenever your brain learns from repetition, I think there's no constant repetition. You can't just be a Superman and put down something you've been doing for 40 years.
All right, Doc. So my last question is for Shalian. There's a lot of myth when it comes down to sexual health and wellness, and we talk about being healthy and stuff like that to help with your erectile dysfunction. So my question to you, Shelly, is: does strong back juice work? Like strong back juice, does it help? Strong back juice.
The okra juice.
The okra juice and all these things. I want to know: is it a myth? People have myths when it comes down to sexual.
Irish moss.
Yes, I want to know. That's just my final question. Like, the strong back juice, does it really help with
Let
erectile
know.
dysfunction?
Actually, have you already experienced it?
Let me just say this for those who haven't realized already. I'm a woman, and so I personally cannot attest to whether or not all of the different front-end lift up beverages at Jamaicans and if they work or not. What I will say is that I know men personally who swear that if it wasn't for some kind of blend up that he drinks, his penis would have fell off his body. So what I will say is that I don't know if it's a mind over matter thing, but there are men who have said that it has worked for them. They swear by it. I know this gentleman in Halfway Tree who sells some things with some raw peanuts in the bottle. And when he described what he has in that bottle, I remember the doctor said that there, if you get certain level of nerve endings dying, that the erection can be permanent. Not with that juice that's gonna have in that bottle. If you give that patient that juice, that feels to come alive, according to him.
All right. Thank you so much, Dr. Sexy. And
Can work for people, you know, but you don't know who it will work for and how it will work because it's not regulated. That's why FDA doesn't approve herbal medication for the entire world. There's no way to formally test and say, okay, this works in this entire population. So some people might get the effect and some people might not. The thing is, we don't know who. So go out and recommend to everybody.
all right, there's so much more we can talk about, so many more questions to ask, but we want to thank you so much, Dr. Angels and Dr. Sexy, and for joining us on JASL After Dark tonight. Thank you so much.
Thanks, Sharianne.
Thank you.
Always informative and entertaining.
Yeah, such an interesting conversation with our guest, which leads us to this week's Now You Know. So, ignorance is bliss is perhaps one of the biggest lies we've tried to convince ourselves. We tell ourselves that what we don't know won't hurt us. Well, all of that is a lie. In fact, we as humans fear what we don't understand. Even with my 2020 vision, I don't see how fear and bliss can coexist harmoniously. It is that fear, coupled with that ignorance and lack of understanding, why we ostracize and treat unfairly those among us who are living with HIV. So, listen to me closely for a minute as I clear up some of those misconceptions surrounding HIV and its transmission. To address the myths, we have to look at where they all started. When HIV emerged in the early 1980s, there was no effective treatment. Positive persons deteriorated, progressed to AIDS, and death was inevitable. People saw HIV as a death sentence and were extremely fearful of those who were infected with the virus. Fast forward to 40 years later, the science surrounding HIV has come a far way, and while there isn't a cure for the virus, modern HIV treatment gives persons living with HIV the ability to live long, healthy lives, to the point where they can pass on HIV through sex. Yes, you heard me right. People living with HIV and are on treatment can have sex and not pass on the virus if they stick to their medication. So why is there still so much stigma surrounding HIV? Well, the science has moved on, but the people haven't. Many are still stuck with the outdated and absolutely ridiculously false beliefs and ideologies. So make a look at them. Some people refuse physical contact with persons living with HIV because they don't want to catch the virus. But touching someone and catching HIV is just as possible as shaking a woman's hand and getting her pregnant. Ridiculous, isn't it? HIV is a sexually transmitted infection. Repeat that with me, class. HIV is a sexually transmitted infection. You can't get HIV from shaking someone's hand, from hugging, from breathing the same air as them, not even from kissing. It's safe to share spaces, tools, and utensils with someone living with HIV. Public bathrooms, swimming pools, and insect bites cannot cause you to contract HIV. The virus simply cannot be passed on in that way. Okay, now that you're asking God for forgiveness, let me tell you the ways in which you can contract HIV. HIV can be transmitted via 4 body fluids: blood, breast milk, semen, and vaginal secretions. HIV can be passed on through unprotected vaginal, anal, and oral sex. HIV can also be passed on through the sharing of injection needles among drug users. Through vertical transmission, which is mother to child, a mother can pass on HIV to her fetus in the womb, to her baby during labor, or through breastfeeding. All right, so let me wrap up quickly. So if you never know, this is what more if you know. 1, HIV is not a death sentence, and persons living with the virus are not to be feared. They deserve to be treated as regular human beings and should enjoy the rights and privileges that everyone ought to have. 2, HIV can be passed on by shaking someone's hand, hugging, being in the same room, not even from kissing. 3, HIV can be passed on through unprotected vaginal, anal, and oral sex, through sharing needles with infected persons and from a mother to child. So, instead of worrying about someone who is living with HIV, ensure they use a condom every time you have sex.
Alright.
So if you never know, now you know.
That's a mouthful. Now you know. Now you know, guys.
That's a wrap for tonight's episode of JASL After Dark. It was a great discussion. Again, thanks to our special invited guest, Dr. Andrews and Shelly Ann Weeks, sexologist, and so much more. Author and all that good stuff, right? And to my co-hosts, it's always a pleasure, being on here with you both, Calvin and Shade, and to our son Jack Lahaba. Yeah, man. And to our producers, Jada Francis, and to our cameraman. Is they the one to
Big up, Ron.
thanks to all our listeners who have tuned in on Sunday 104.9 FM, those who are locked in on our Instagram page and our Facebook page. Again, you can watch us on JASL Info, that's at JASL Info on Instagram, and on Facebook, it's Jamaica Aid Support for Life. Join us again next week, Wednesday, same time, same place, for another exciting episode of JASL After Dark. Real love is knowing someone's weakness and not taking advantage of them, knowing their flaws and accepting them. And remember, gentlemen, impotence is just Nathan's way of saying no hard feelings.
No hard feelings.
All right, that's a wrap, guys. Join us again next week. Yeah.
Come on,
Yeah, man.